Hello, I'm Suzanne Bassett, speech-language pathologist at the Speech Therapy Centres of Canada. Today I'm going to be talking about how to protect your voice when you have a cold. So we all know the effects that a cold can have on the voice, from the stuffed up sound to hoarseness to perhaps even losing your voice altogether. What people don't always know is that how you take care of your voice when you have a cold can make the difference between these difficulties going away just as the cold gets better, or further problems being created with your voice that can last for many months, even long after the cold is gone. So what can you do? Well, the first thing is to stay well hydrated. Your vocal folds are actually at the top of your airway, so what you drink doesn't pass directly over them, but as you keep your whole body hydrated, it hydrates the tissues in the vocal folds and helps them to move easily and gently. And this is especially what you want when they're already irritated from the virus. Make sure that the atmosphere around you is humidified. So use a humidifier, breathe in steam for a few minutes, a couple of times a day, have a sauna, a long hot shower, and also as much as possible take nasal breaths, because that will naturally humidify the air as it passes over your vocal folds on its way to your lungs. Be careful of coughing. Coughing is very bad for your voice. It slams the vocal folds together, and it can even lead to vocal nodules. To avoid coughing, take a long, slow breath through your nose, and then take a sip of water, or just swallow. So if you do that whenever you feel the urge to cough, you'll often be able to avoid coughing altogether, and it will calm those nerves that make your throat all irritated. You can also suck on ice chips or hard candy. Cough drops, however, are not recommended, because the vapors from them, the medicated vapors, can irritate the vocal folds. Use a gentle voice when you have a cold. The tendency when your voice is a little rough is to push against that, to try to produce a voice that's as loud and as strong and as clear as your regular voice. So just use your voice gently. It's what we call a confidential voice. So this is the voice that you use when you don't want to be overheard. You're having a private conversation. It's easy, you're not pushing anything, the vocal folds are vibrating nicely. And I'm not talking about whispering. When you whisper, you create tension in your throat. So either pushing against your voice hard or whispering is going to create tension in the muscles in your throat, which will set you up for problems later on. So just use an easy, gentle voice, and if your voice tires, take a break. So stay hydrated, avoid coughing, use a gentle voice. If you do find that you continue to have problems with your voice after the cold is gone, so for example, the hoarseness remains, or you find that your voice is tiring more easily, or that you've lost some of your pitch range, or you get an ache in your throat whenever you have to talk for any length of time, you should see your doctor. He or she may recommend voice treatment to help you recover the easy use of your voice.